Hi, I'm Amanda, and welcome to Sullivan 180 Presents Take 5. Our guest today is community health nurse Amanda Wolfe, RN from Sullivan County Public Health Services. Welcome, Amanda. Thank you so much for being here. Would you mind introducing yourself and telling us a little bit more about your role at Sullivan County Public Health?
Hi, my name is Amanda Wolfe, and I'm a registered nurse for Sullivan County Public Health, and I work in the epidemiology department. I would say that my role currently over the last year, being that I work in infectious disease, has been focused on the coronavirus and the pandemic. So at the beginning of the pandemic, my role was case investigation, investigating positive cases and contact tracing and public education, trying to enforce the importance of mask wearing and social distancing and cleaning and disinfecting. And we'd been doing that for a very long time. And then as the rollout of the vaccine came to be and we were able to get vaccine through New York State, we started working on that.
So there are still a lot of people hesitant to take the COVID-19 vaccine, or they're taking that wait and see kind of approach. Why do you think that is right now?
I think that hesitancy comes in part from human nature and the fear of the unknown. And I think that everybody in the United States has been affected by the coronavirus and a year full of unknowns. And everybody's been affected in no small way by this pandemic. So I think that there's also a great deal of hyperinflated anti-science information that can be found on social media. And I think that kind of information is designed to be attractive, and it can really play into people's fears. It makes us feel like it's okay to be afraid of something, and it helps us support that. So what I think is important is that I think people are looking for security vaccinated, because then, we can get vaccinated, bring up our herd immunity, and life can go back to more like it was before the coronavirus.
What do you think are the top two myths out there about the COVID-19 vaccine?
Well, there's a lot of them, but I would say that kind of a combined myth is that it's all too new and that it's just an experiment, but I think that, science has been researching these new types of vaccines for over a decade, and the science is sound, and over 1 billion people on the planet have already been vaccinated, but we have 7.8 billion people on this planet, so we have a ways to go yet. I think it's important to remember that this pandemic is global, and that by getting vaccinated, you not only protect yourself and your family and your local community, but also the larger global community. I have taught us that as a people, that we all look different and come from different backgrounds and communities, but everybody's breathing the same air, and do whatever we can to help stem the pandemic, because we should all know, I think everybody's aware that the other side of the world is just a plane, and we're all in this together. That's for sure.
So important. Thank you so much for sharing that. Are there some vaccines that are better than others, and should people be waiting for a certain type?
No. Any vaccine that is available to you, so right now it's Moderna, Pfizer, and the Janssen & Janssen, whatever vaccine is available to you and a medical practitioner is offering to you is the right one to get.
Fair enough.
So it's whatever one is you're able to get first is the one that you should get.
Absolutely. The sooner you're vaccinated, the more you can protect those around you and yourself.
Yes.
Absolutely. Please share with us the best way to stay informed on COVID vaccination opportunities here in Sullivan County.
Well, there's a lot of postings on Facebook, on social media when clinics are available. Also, Sullivan County government websites are a good way to find out when clinics are being held.
Absolutely, yes. They're being shared more and more. So hopefully everyone's getting access and everybody's getting the information to get to a vaccination opportunity. Anything else that you would like to share?
I think that the public needs to be aware that the public has the power to stamp out this pandemic. And people who can get vaccinated should get vaccinated as soon as possible with whichever vaccine is available to them. People need to continue mask wearing and social distancing. I mean, we know that the rules have changed for small gatherings of vaccinated individuals, but that does not mean that we should throw caution to the wind. we need to continue to follow safe guidelines when we're outside of our homes, and just encourage your friends to get vaccinated. If you're already vaccinated, ask your friends, have you been vaccinated? Talk to your family, spread the word about how you got vaccinated and you're feeling just fine. But you're also now protected, and your family is more protected, and your friends are more protected.
Absolutely. Amanda, thank you for joining us again today. It truly means a lot. I hope you know that the work that you're doing is saving thousands and thousands of lives. You truly are an incredible health hero. Myself and Megan, we've had the pleasure of being at the clinic with all of you and seeing what happens at these vaccine pods that truly are lifesavers every single day. So thank you for what you're doing. And we all owe you our heartfelt gratitude to the work that you're doing every day. So thank you.
Thank you very much. We're happy to do it.